In China, mutual aid is becoming a popular alternative or supplement to health insurance. It involves participants forming a group where if any of them get sick with any of the covered conditions, they're eligible for payouts that would be covered by group members rather than an insurance company. While basic medical insurance, which is part of the country's mandatory social security program, can cover up to 60% of serious medical expenses in China, the remainder is paid out of pocket. But for its roughly 1.4 billion people, basic medical insurance is far from enough, and commercial health insurance coverage in the country is quite low, at less than 10% according to the Insurance Association of China. With a combination of medical insurance and mutual aid, out-of-pocket expenses can potentially be lowered to 20% or less for the entire bill for covered ailments. According to an Ant Financial white paper released in May of 2020, nearly 70% of mutual aid users in China weren't covered by commercial health insurance. 72% were from lower-tier cities and rural areas, and about 80% earn less than $1,180 per month. There are an estimated 150 million users of mutual aid in the country, with projections that coverage will reach one-third of the country's population by 2025. Songhua, which means mutual protection, was launched in 2018 by Ant Financial and was one of China's first mutual aid plans. The plan covers 100 serious conditions, and recipients of payouts are eligible for anywhere from 100,000 to 300,000 RMB. Participants paid an average of 29 RMB in 2019, and for 2020, the cost was capped at 188 RMB annually. In 2019, membership was expanded to include those between 60 to 70 years of age to help cover medical costs related to cancer. By the end of 2019, it had already reached over 100 million users and had around two-thirds of the entire market share. As of now, the plan has provided payouts to 46,128 people, almost half of whom being post-80s and post-90s. Waterdrop Mutual from Waterdrop Inc. has around 70 million members. The company was started by former Meituan Dianping executive Shen Peng in 2016 and began as a crowdfunding platform for medical patients to raise funds. Coverage includes 60 kinds of diseases, including stroke and diabetes. Even those with pre-existing conditions can join. In 2019, they raised 1 billion RMB in a Series C funding round from investors including Tencent. Today, Waterdrop Inc. offers mutual aid, crowdfunding, as well as insurance sales. Bihu Huzhu, which translates to Gecko Mutual Help, is a platform of several mutual aid programs, including a newly launched one covering COVID-19. It has compensated about 2,000 individuals on the receiving end of funds collectively worth around 158 million RMB. Members pay 10 RMB to join, and for each deal, each user only contributes a maximum of 9 RMB. The platform itself is meant for healthy people who are faced with unexpected illnesses or accidents, although they also offer a crowdfunding platform for those with pre-existing conditions. In October of 2019, social media platform SignUp bought a 4.6% stake in Bihu. Launched on June 15, 2020, Xiaomi Huzhu is a product baked into Xiaomi Finance app. There are no admission fees, and the plan covers costs related to 82 critical illnesses and 10 illnesses that primarily affect children. Compared to Songhua, Xiaomi Huzhu offers a higher one-time payout, up to 500,000 RMB. In order to attract users, Xiaomi Finance offers red envelopes for those that can sign on new members. Members must pass a 180-day probationary period before being accepted, and since launch, have gained over 8,000 users. Didi, China's largest ride-hailing platform, has also rolled out a mutual help plan called Didi Shouhu. Those between the age of 28 days old to 59 years old are eligible to join, although there is a 180-day waiting period, and payouts can range from 50,000 to 500,000 RMB, depending on age and severity of illness. There has been controversy over the plan, however, with some Didi users reporting payments being deducted from them while they are not a part of the plan. Local media reported that these users might have unwittingly enrolled in the plan, which is accessible directly from the Didi app. As of late June, it had 1.1 million users. Many companies have rolled out or are in the process of rolling out mutual aid programs, including the likes of Fosun, Baidu, Suning, Qihoo 360, and Meituan Dianping. While these mutual aid platforms can provide a financial relief for those unable to afford the expenses incurred by critical illnesses, they also carry with them a risk due to their unregulated nature, because unlike insurance, they're unlicensed by the China Banking and Insurance Regulatory Commission.